Waking up exhausted, heading to work exhausted, doing my job exhausted, taking my break exhausted, driving home exhausted, made it home exhausted, accidentally stole a mask from work because I'm fucking exhausted, took a bath exhausted, going to bed exhausted, waking up exhausted, just to do it all again. Hi, how are ya? My name's Alice, and I'm a CNA. There has been so much going on since this COVID crap started, and I figured I might as well put my 2 cents in right now while everything's happening, so I'm going to do it now. There are so many videos that I can make right now about being a CNA, so many things, but right now the COVID crisis is going on, and I wanted to talk about that because I work at a place that can be likened to an assisted living facility, otherwise known as a nursing home, but I work in subacute where people are not there long term or until they die. They're there because they've broken a bone, or they've got some kind of injury or infection, or they've gotten a brain injury, or they've had a stroke, or etc. Something that's new to them that they need to learn to cope with or heal from so that they can go home. That's my job. I work in subacute. I help people with their rehab and their therapy. We have physical therapists, but as a CNA who works in subacute, it is part of my job to make sure that as they are transferring from their beds to their wheelchairs and back into the toilets and and wherever else they are going, that they are transferring the ways that the therapists have specified, including their meals. The speech therapists and occupational therapists, we make sure that they do everything the way that they have been taught. It can be really frustrating for them because they've been living their entire lives, usually independently, but because of this new thing that has happened to them or that is occurring in their lives, they have to learn how to do things differently, or sometimes have to learn how to do things all over again. And it's very frustrating for them. Being a certified nurse's aide or certified nursing assistant is a lot less complicated than it sounds, but it's way more complicated than simply being an aide to a nurse. We don't just sit around waiting for the nurses to need us. We've got a whole other set of things to do that is independent of them. But because we exist, the nurses are able to do their jobs, usually uninterrupted. We do everything from changing people, helping them to go to the bathroom, helping them change their clothes, giving them showers, helping them with activities of daily living like brushing their teeth, ambulating, scratching their backs, as well as some housekeeping and general, upkeep of the area. We do a lot, and there are a ton of us. So, it's COVID-19, everybody! So when this COVID stuff was happening, for a couple months, it wasn't even on our radar. We didn't do anything about it. We just heard about it in the news, and we were worried about it coming to the US. We did actually have a large number of cases that looked like the flu that include respiratory distress, but tested negative for both pneumonia and flu. So we didn't know what to do. We put PPE on their door like we usually do, and we just dealt with it. And it's possible that it was already going around well before we were aware of it even being in the US.
I'm not saying that that's what it was. I'm just saying that it's a possibility.
So when this stuff started, we were just warned that we needed to make sure that our scrubs were always clean, like they always are. We basically observe our usual hygiene practices, because if you work in healthcare of any kind, your usual hygiene practices are plenty. Some people panic and some people think that you need to do more, but there isn't much more that we can do because we already wear the gloves, we already wash our hands to the point of being chapped. Yeah, my hands are fucked up. When the number of cases of COVID started getting higher in the US, the CDC put out guidelines that made sure that all nursing homes and assisted living facilities and rehab centers like the one I work in are locked down and closed to visitors. The only time visitors were able to come in was if a family member was on hospice and close to death, if they were on comfort care and they were about to die. And there were a lot of people coming that first few days to visit their family members and crying because they couldn't come in. They could come into the front desk, but they could go no further. But there were a lot of people who were really worried about their family members. We have to assure them that we are doing everything that we can to prevent COVID from entering our facility, and that
their family members will be taken care of. The facility itself did not choose on its own to lock down. To be honest, I don't think we would have locked down for a few more weeks if the CDC had not put out those guidelines. Because at the time, we didn't see the threat to be so big, but within days, I don't remember what day of the week it was, but we locked down, and then within days, we had cases in Missoula, and we had people in the hospital right next to the rehab center who were being quarantined. Just a couple people, I think it was only 2 at the time, and then within a few days, we had 9 cases. Now we have almost 300 in Montana, and we have 6 deaths to date, 1 in Missoula, and it's only been a couple weeks. Since I filmed this, which was a week ago, the cases have risen to 399 with 197 recovered and 7 deaths. So the numbers have not changed that much. So it was good that we locked down at the time that we did, because at the moment there are people who are still traveling to get away from hotspot areas, and that's the whole reason it's being spread at the moment. My friend made a post on Facebook about how she had to deny a New York couple from coming to stay at her house because her house, first of all, is not a quarantine zone. If you are traveling, no matter where you're going to have to isolate for 2 weeks. And if you are only here for a certain period of time, you're not going to get to see the family member that you came to see because you're going to be isolated, and so are they. Right now it is April 7th, but on April 1st, my friend made this post. I had to refuse service to people coming from New York to Missoula. They said they are arriving tomorrow and looking for a place to stay for the next couple weeks. Their reason was they wanted to be closer to their dad. We had to tell them that it wasn't worth risking the community's safety, that nobody should be traveling right now, and that they need to self-quarantine after traveling anyway so they wouldn't have any time to see their dad. I'm saying all this to remind everyone that there are still people traveling here to get away from the hot spots, and there are a lot of people who still don't/won't ever take this seriously. Don't get lazy with keeping your distance from people. You can't be completely certain how much they've been exposed. Hopefully those travelers quarantine when they arrive. The safest thing for you to do is stay where you are and stay indoors. If you go outside, wear a mask, don't touch anybody, have hand sanitizer at the ready, and make sure you maintain your distance. Do not travel outside of where you are, because even if you just so much as have the virus on your clothes, you will bring it with you because it doesn't die for days. The CDC has been coming up with updates very often. In the first week or so, it was every day. It was multiple times a day. We'd be told one thing in the morning, and then within a few hours, we'd be told to scratch that. We've got to do something entirely different. We have to be adaptable because things are changing, and we're learning new things every day about the coronavirus and how it spreads, how long it survives in the air, on clothes, on cardboard, and implementing new measures to prevent it from coming into our facility. To date, we have no cases in our facility. When we come in the morning, since the lockdown of our facility, we've been getting screened. So we have a questionnaire that we have to fill out every single morning with our phone number, our name, and our temperature on it. Because if we have a temperature and we have any of the symptoms on that questionnaire at all, we will be sent home. No, we won't get paid. And the thing is, because I am working right now, nothing's been put on hold. I still have bills and I am right exactly where I was, which is barely able to pay them in the first place. And we are all working very hard. We're exhausted. We are so done with this. So when we come in, we have our temperature taken, we fill out the questionnaire, and then we have to sanitize our hands before we do any of that. We have a clean pen cup and a dirty pen cup, and it's just everything. So within the first week of lockdown, we had a meeting on the hall that I usually work on. And that meeting was to tell us what our next steps were. Our next steps were to move everyone from my hall to the other subacute unit. Because my hall does not have any through traffic, it's kind of an isolated wing, so we've turned it into an isolation wing. There are 10 rooms on that hall, and that means that at most during this crisis and lockdown, for as long as it is going, there will be 10 people on that hall. At the moment there are 8, but in the beginning there were 3, and the reason is because anybody who is admitted to the rehab center that I work is going to be put into isolation for 2 weeks. no matter where they came from, whether they test positive or negative or not. They're going to be put in isolation to be monitored for respiratory symptoms. They're going to be tested, and they're going to be kept there just in case. Even if they're negative now, they could test positive sometime within those couple weeks because the antibodies don't show up the day you catch it. So far, nobody has come in with it, so that's a huge plus. In the beginning, when we had a couple scares, they started putting these masks on the door. They're disposable paper masks with plastic visors on them because COVID is also a droplet precaution, which means that we have to make sure that our bodies are all protected so that the droplets don't touch us in vital areas like our mucosal membranes, which are in our eyes and our nostrils and our mouths, and that we're not spreading it anywhere with our hands. The PPE gowns that we wear are these like yellow, you've seen them on Grey's Anatomy. They wear them every time they go out to the ambulance. Those yellow PPE gowns that look like they're made of nothing, they're highly effective. And I'd talk about them, but I don't think I have time for that because I'm exhausted and I just got back from work. Since all of my patients moved from my unit to the next unit, I moved with them. Since there are so few people on my unit, they're only requiring one CNA to be down there. Once the 2-week isolation is over for the people who are on my usual unit, they can be moved anywhere else in the building. But until those weeks are over, they are isolated, they are stuck there. Of course, they will have their physical therapy, occupational therapy, and speech therapy as scheduled, but everyone who comes into contact with them, even if they are completely asymptomatic, which most of them are, we still have to put on full PPE because we just can't risk the chance of them having it even just on their skin when they come in. When I left last week for my weekend, I had this mask here. This is it's not a surgical mask. Well, a surgical mask is really simple. It's like this one without the visor, and they're usually blue or yellow. We don't have enough surgical masks to be going through for everybody who needs PPE on their door. Because not only do the new people have to have it on their door, but people who already have infections that are not COVID do have to have PPE on their door, like MRSA, if they have C. diff, if they have any infection, we have PPE on their door. We just don't have enough PPE for everyone in the building right now. And since that's the case, they're trying to switch us from the paper gowns to fabric gowns, and they're trying to make it so that the laundry is on it all the time because we can only use those gowns once. And we go into those people's rooms multiple times a day. So unless they're positive for something, we don't actually need the gowns, but we have to wear masks and gloves. And if somebody is coughing, we have to wear goggles, and we have to sterilize them every time we leave because we have so few pairs. When I left last week, because we don't have enough masks, we had a box of these masks on the unit, and the nurse and I started putting ours in a plastic bag to reuse because we can't run out of them. You might think that that sounds unsafe, but we'll wait till I tell you what's happening right now. Over the weekend, while I was gone, I got a text from work. Alert, please come in 10 minutes early to next scheduled shift to set up new mask program. So when I read that, I was like, well, I'm not at work, so I don't know what that means. But I assumed that it meant they were going to educate us some more on masks and stuff like that. But when I came back yesterday, I learned that it's because they want us to wear surgical masks all day long, and that we were going to wear the same mask over and over again because we don't have enough. So the plan was that we have these paper bags and we put our names on them, and every time we go to our break or whatever, we put our mask in that bag. Then we take it out and put it back on when we go back onto the hall. If we go into a room that has PPE on the door, we take that mask off, put it back in the paper bag, put on a new mask, dispose of that one when we are finished, put on our unit mask, and go about our business. If we go outside, we're supposed to save our mask, and that mask will be the same mask that we wear tomorrow. But within a day, they already had a tote full of fabric masks. I guess over the weekend, some people got together and started sewing tons of these fabric masks, and they look just like regular surgical masks. They're just made out of fabric with elastic. And it's the same thing that I said with the surgical masks. We take them off to go into rooms with PPE, or when we go to our break, or when we go outside. But it's not going to be the same mask that we're wearing tomorrow, because we have a bin full of clean masks and a bin for the dirty ones, and every night they're going to put them through a sani rinse in the washing machine. And even since then, on the 10th, we got an update saying that we are gonna go back to surgical masks, and we're supposed to wear them for multiple days, which I am not going to fucking do because that's disgusting. So I've been throwing mine away at the end of the day, which I think everybody else should do. They are single-use masks. They're not even supposed to be used for more than one session, and yet they're having us use them all day long. And then they're telling us to use them for multiple days, and that's just super gross, and I am not standing for it. And when we run out of the surgical masks, which will probably be never because they want us to wear them until they are too disgusting to wear, then we will return to the cloth mask protocol. But they want us to be wearing masks in the community as well. So I have my own mask here. This one is from Japan. It's just a simple black mask. So the idea is that when I wake up in the morning, I'm supposed to put on my clean scrubs. I've also been filling my pockets with these because it's a lot easier to just have them on hand than to go looking for them every single time you need to sanitize something. Also because I've been sanitizing my temporal and my pole socks between every single person, which we're supposed to do anyway, so it's not like it's a new thing. Again, we already implement extreme hygiene procedures on a normal daily basis. A lot has not changed. What's changed is that we're wearing masks all day, and I cannot tell you how fucking uncomfortable that is. So having a mask on my face all fucking day is making me lightheaded. I get really, really hot. So I've been checking my oxygen every so often during the day, and my oxygen's been fine, but I'm lightheaded, which I am attributing to the heat that I am feeling because it's really hot wearing it all day. It's okay to wear for a short period of time, but when you wear it all day, it's bruh. And I feel like I might get a heat stroke. And those fabric masks that they sewed up during the weekend are thick. So there are a ton of other videos that I can make about COVID and what's going on, but that's the basics of what's going on right now. I can probably update you guys later as the situations progress or decrease or continue or whatever. But here in the United States, we don't at the moment see an end. Numbers are increasing very quickly every single day, and although the numbers are already tapering down in China, there are a lot of people in the US who are still traveling, and I understand why people are traveling, but all I can say is don't. Stay where you are. It's the safest thing you can do for yourself and for whoever it is you're trying to visit. Because even if you don't have anything on you, you can catch it on the way, or you can catch it where you're going. Until we've got a vaccine, until we understand what's going on, until we have prevention measures, please, please stay the fuck at home. I'm not going to make a video about what COVID-19 is because we've had it thrown in our faces, left, right, front, and center, and a lot of that information is coming up from the back with no warning. Only go out when necessary. When the lockdown first started and the stay-at-home order began, traffic was a dream. I was driving home today, and it was pretty much the same as it usually is when this stay-at-home order didn't happen. So you can see how the longer this progresses, the less people are taking this seriously. And that's a big reason why the numbers are rising. For the love of everyone who is taking care of your loved ones, who are in hospitals, for the love of fast food workers and people at the grocery store, stay the fuck at home. So that's all I'm going to say for today, and by that's all, I mean I know that was a lot. A lot of people are saying, you know, they're howling at 8 p.m. because they are supporting essential workers, and they're also finding a way to come together at a time where you can't physically be close. And I think that's great and everything, but if you've never worked in healthcare, and if you've never been a fast food worker, if you've never worked at a grocery store, you don't really know how hard a job it is. And that is why I am not at all surprised workers were going on strike several years ago to have minimum wage raised, because these people are the ones who are left working while everybody else is laid off, because their jobs are what is considered essential and they get paid the least out of everyone in every one of those corporations. Again, another video. So I'm gonna leave that here. Jane.